Hello everyone, this is Malka Assad and welcome to the third part of the case report series. In the first part, we discussed how to start with the case report and how to assess which cases are publishable and which are not. In the second part, we covered the case presentation, and in this part, we'll go over the introduction of a case report. Several aspects of the introduction of a case report also applies for full text articles, but there are also differences that we will cover in future videos. I want to start by having a general outline of the introduction. I always imagine the introduction as a funnel shape. It starts from the general background of the topic you're writing about, and it goes to the specific case that you'll be discussing. And we'll go over some examples, but always keep this funnel shape in mind because it helps you narrow your introduction from the first paragraph to where you say we're reporting a case report about what the case is about. Have a final, before you talk about your case, have the final paragraph about the gap in knowledge, because if there are several cases in the literature, you have to state in that specific paragraph, and I'll show you again examples for that, why your case should be published. In that specific line, you either say, this is the first report of this disease, or you say there are prior reports about the same exact thing we're talking about, but what makes our case unique is this, this, and this. And that will make it easier for the reviewer to give a positive comment on your case report, because now you outline what makes your case special. Again, the prior literature on the similar case reports and the topics in general is very crucial when you're writing the introduction. I stated in the first video that having a very good literature review done makes it easier for you not only to write the paper, but to know whether this paper is actually publishable. Because if you find so many papers written about the same topic, you might choose something else to write about. So again, here comes the literature review that you've done earlier to help you with writing the introduction and the discussion. I recommend avoiding non-relevant topics. One of the challenges of an introduction is that there is so much information about the topic in general and the specific, and you have to be selective in the amount of information you include in your introduction. Because introduction, I recommend generally having it between 300 to 800 words, but don't go over that, because that would make the reader lose the attention and get distracted. So keep it only relevant to the topic you're talking about. Something else to mention here, that there are certain words or medical terms that you use in your introduction and your discussion that might not be knowledgeable to the readers of the journal you're putting your article in. So let's say that there is a famous term, let's say cabbage, for example. And if you submit this article to a cardiology journal, they might know what cabbage means, or other terms. Cabbage stands for abbreviation, but there might be other terms familiar to people in the cardiology field. And if you send it to a cardiology journal, they might not have a problem with that. Everybody knows what this term is. But if you're putting your article in a medical journal, in a general medical journal, you have to explain what that term means if it's not familiar to the readers. So tailor your explanation to the word and the topic to the readers of the journal. And this changed. So if you're sending your article to a specialty journal, make sure that the readers of that specific journal know the terms and the general introduction. The introduction goal is to make it easier and give a background of your topic to the readers. So if you feel that your readers already know about this topic and they don't need that big background, you don't need to give a very big introduction. If you're sending it to a general medicine journal that they're not that familiar with the topic, you have to make it more easier for them to understand. Now we want to go over some examples, and we discussed this case report in the prior videos. It's about the first human face transplant. This is the outline, and as I mentioned, I always recommend having an outline of your introduction, case presentation, and discussion before you start writing, because that helps you keep your ideas focused and to the point. I mentioned here what the authors actually reported in their introduction. And let's take a look back at the funnel and imagine we have a face transplant case report we want to talk about. What is the general, you have to ask yourself, what is the general topic in my case report? In this case, it's the allograft transplantation in general. It's not the face, because the face is the actual specific topic you're discussing. The general outline, the general background is, in general, the allograft transplantation, which includes the face, the kidney, liver, and all these. So I would start by talking about the allograft transplantation, and then I would go specifically to the face. So the authors in this paper started by discussing the need for allograft transplantation. They discussed how failure of conventional therapy made allograft transplantation necessary. And then they went specifically now to the face, because there are articles about face transplant. So they started with the general allograft, then they went to the face, and then they discussed the suitability of face for transplantation. They discussed the challenges, which is the immunosuppression and the ethical, and they say we report the first case of a human face transplant. Somebody might ask, how do we get this idea? I know that the general would be the allograft transplantation and the specific is face. How do I know what to talk about, what to discuss? One way is reading articles. The literature search that you did at the beginning and now is going to help you get ideas. You see studies from prior literature discussing the need and the complexity. So you get ideas from these studies, and of course you reference them when you mention their results. Always have an outline. You think what suits your introduction best, what would serve the reader best to understand what you're saying. You have to understand what is the message you're trying to convey, and then you tailor your introduction to that specific goal of your study and to the readers of the journal. I recommend, I mentioned all the references here down below, and I will leave them in the description under the video, so you can go and read the introduction of these articles. I chose very well written articles, and this can help you see how the introduction should flow. In this article, I will talk more about the introduction. This is a follow-up study on that same case report. It's 18 months after the first face transplant. The authors are reporting about the long-term outcomes, because as you know, there is a problem of immunosuppression and rejection with the transplants, and the authors are reporting the long-term outcomes. Again, the link and the reference is here, and I will mention the link in the description. Again, the authors started with the general background about composite tissue transplant grafts. If we read together, you can see that they mentioned how the past decade there has been an increase in transplantation. There has been several organs that have been reported, and why the need for composite tissue transplantation, which is the severe defects that can be repaired with functional outcomes by conventional surgery. This is very well written introduction, and it follows the same funnel shape, going from the general, talking about why it's needed, why do we need composite tissue transplantation, and then they go into the specific of their case. So they talk about their previously reported case, and I mentioned here the general outline they had. The specific background they chose here is the face transplant in animal studies, and we'll go now over that. And the specific background of the challenges they faced with their case. So let's see how the authors wrote this section. They talked about their case that they reported previously, and they referenced it. And then they mentioned some results from the animal studies, the challenges that has been shown in both the surgical considerations, the immunological question, the psychological consideration, about the face specifically. So now they went from the general to the face and its challenges. Now, and then they mentioned the gap in knowledge, and here where the gap in knowledge comes. After you talk about the general background, the specific background, you go to the gap in knowledge. The gap in knowledge in the first report that there was no prior reports. That was the gap in knowledge. In this, there is already a case report, which is actually their case. The gap in knowledge is that there is no long-term outcome. And the authors made it clear here that this is their goal of this study, which is to report a follow-up on 8 months afterwards. This is a recently published article I wrote, and we discussed the case report of abdominal wall reconstruction using a segment from the ileum. So the ileum was cut open and used to support the vascularity of the abdominal wall. So let's say that we want to write an introduction, and what would be the general background for that topic? The general background is abdominal wall reconstruction. It's not the ileal segment, because the goal of this study is abdominal wall reconstruction in general. So the background, the big background, the general one is indications, etiology of abdominal wall reconstruction, when do we do it? The next point I discussed is how do we do it? Because usually there is a general way of doing something, and you're reporting an unusual way, which is your case. That's why it's going to be published, because it's unique. So it's good to give the reader of this article what do we generally do. This is what I sometimes see missing. As a reader, if I'm not familiar with your topic, I want to know how it's generally done and why your case is unique. Why are you doing it this way? So I gave the indication and etiology of the abdominal reconstruction in general. When do we do it? What are the cases that need abdominal reconstruction? It could be a hernia, it could be infection, trauma. And then I mentioned the reconstructive options. For example, muscle flaps, component separation, mesh. So I just gave the reconstructive options. And then I discussed when each flap type is used, if we want to use soft tissue reconstruction, and why these were not an option and what we used. Make sure that you don't go into details why you chose this specific case in the introduction, because that could be touched upon in details in the discussion. Because you have in the discussion to talk more about why you reached that specific decision of your treatment. Again, the reference is down there. If you want to read the article, it's available. Quickly over this JAMA article, it's about IgG4 related neuropathy. It's a case report. The author started by the general background, which is IgG4 related disease, what organs does it involve, and then they went specifically into the neurologic manifestation of the disease. And then they mentioned this could be the gap in knowledge and the beginning, the sentence preparing the reader for the case presentation. As I mentioned before, I mentioned the case presentation before the introduction in my videos, although it comes afterwards in the actual paper, because usually I prefer to write the case presentation before the introduction and discussion, because this is information you have, unlike the introduction, you have to write it from your case and the literature, mainly the literature. So they mentioned for the first time to our knowledge, we describe and you mention one line about your case. Again, this case, this is the introduction, the whole introduction of this article, because you have to be careful. Some journals give you a limitation on the number of words you can include for a case report. They, for example, limit you to 800 words for the whole article, this case presentation, discussion, introduction. So it's fine to include a short introduction like this. But if your journal gives you the freedom to write a long paper, around 1500 words, I recommend having a longer introduction. I don't think this should be sufficient for a full case report if the journal allows. Unless you can convey every information you want to address within 3 lines, which is not usually the case. So this one is a metastatic Apocrine Adenocarcinoma treated with a combination of Pertuzumab and Taxane. The authors mentioned the general background in one line, no effective treatment for the metastatic cancer. Went more specifically into the fact that some metastatic cancer express the HER2 positive, And then they said, we report the case of, and they explained their case in one line. This case, I'm going to go more into details, and I'm going to show you an example of a modified introduction I did. And then I will show you the original one, so you can compare what makes an introduction a better introduction. So this is a duplication of the mouth with a cyst. The author started by the general background. What could be the general background on this topic? The duplication in general. Duplication of any part of the face. This is the general background. The specific is the duplication of the mouth with the cyst. So you have to be very knowledgeable about the topic you're writing about, and how you get the knowledge by reading articles, book chapters about the topic, but I recommend generally articles. Once you know the topic, you can decide what is general and what is specific, and you can support your claims with references. So the author started by the duplication of face in general. They mentioned some manifestations of the full and partial face duplications. Then they mentioned the 4 categories or types of face duplication, which brought them to the duplication of the mouth, because it's one of these 4. They started from full and partial to the types to the mouth. You can see it's funnel shaped, and it's flowing without having the author wondering what's happening here. So then they discussed that duplication of the mouth is a subtype of the partial full duplication. They mentioned the gap in knowledge. They said that there are 7 reported cases, and some might wonder, well, if there are 7 reported cases, why are we publishing this as a case report? It's already been published. They report why their case is unique. And you have to make it clear to the reviewers that there are prior cases, but this is what makes our case unique, that they have assist with the duplication. And in this way, they explain their case. I always recommend the last line of your introduction for a case report. Mention that we report the case of, and mention in one line what your case is about. So this is the modified introduction. This is not the original introduction that the authors wrote. It's the one I modified. I recommend you pause the video and read it. I'm not gonna read it now. I recommend pausing the video and read it and see if you find any problem in this introduction, where the problem is. And in the next slide, I will show you what I modified from the original introduction. So this is the original introduction that the authors wrote, and this is the one I modified that was in the prior slide. I'll go over some of the things I made, and you can see how the original one was a better introduction. You see how diborsophus is the encompassing term for full or partial cranial duplication. Here I use the first two. It's fine, it's not wrong, but you can see how this is a better phrasing of the same thing, is the encompassing term. And some might ask, how do I get to that level? By reading articles and see your mind will absorb words and expressions when you're reading more and more articles. This is one, for example. If you noticed here, the authors had linking words, so many linking words, and I just kept it blank. One sentence, one sentence, one sentence, one sentence, without linking them together. And if I read it, I feel, there is something broken here. The things are not linked together. And it makes it harder for the reader to understand what you're saying and to enjoy the article. And you want your readers to enjoy your article as much as possible. So you can see here of which there have been. I just put a period. And this is what I see in most introduction that have problems. They just put periods and they go to next sentence without linking the sentence together. So of which there have been only 100 cases, I said there have been only approximately 100 cases. Then I mentioned this sentence. The embryogenesis of facial full duplication is complex and poorly understood. And then I go to the central nervous system manifestation. Some people might not see a problem with that, but the problem I see is that this is kind of falling in the middle of nowhere, because we started by talking about full and partial, how many cases there are, the manifestation, and then the immunogenesis is kind of in the middle. It does not fit here. What the point I'm trying to convey here? It does not follow the previous or the following sentence. I'm not linking this idea to the whole introduction, so I don't think this fits here. Having the relevant information is more important than making it long with just random information here and there. Here I added a sentence about the central nervous system and how it can cause significant decrease in the patient outcomes, although it's fine to include it, but this does not fit with the whole introduction. Why? Because this paper goal is not about the central nervous system. So although central nervous system is one of the manifestations, but it's not the goal of this introduction and this study. So that's why it doesn't fit here, and it cuts the streamline of thoughts for the reader. So try to include everything that would fit together. Here, for example, I removed whereas, I just put period. So most infants with complete facial duplication exhibit, I just chose have. Have is fine, but exhibit is a stronger word. Severe central nervous system defects, whereas those with partial. So you see how these two sentences are not connected? It's cut here. Those with full, those with partial. And then I went side with the central nervous system. It's also evident that I just started with several anomalies. It's not wrong, but I'm showing you how you can make your introduction a better introduction. But this is the author who made this classification, and they gave the year. I just mentioned that this disease is divided into 4 types. It makes your introduction stronger and makes you appear as someone who knows the field by mentioning the authors, the year. It makes also the reader know that you did your literature search and you know exactly when this happened. And then I end this by several theories have been suggested to explain this anomaly. I don't go over and explain what that means. It's again falling in the middle of non-related sentences. The main problems that just to summarize what I discussed here, the main problems that I made in modification of the author's introduction, I cut the sentences, removed the linking words, and I just put periods. And this is what I made, the things that I usually see as a problem introduction, so you can be careful about them. The choice of words, adding non-relevant sentences in the middle, and discussing things without either following on them or linking them to the full introduction. And I want to tell you that you won't get it right from your first time. That's why you should have a mentor, you should have a PI who's gonna give you feedback on the introduction and the paper, modify it, go back and forth. Even when you're advanced, you need somebody else's input to make it as good as possible. So with time, it takes time. Writing, it doesn't happen overnight. The more you write and the more you read, the better you are. The more feedback you get, the better you'll be. Some people get offended when they get feedback, especially when they see the whole paper full of track changes, it's looking like a rainbow paper. That's fine. You should learn from these comments. People are trying to help you, and you should get these comments and try to improve yourself and your paper, because nobody has anything personal with you. They just want to improve your work and help you. That's going to wrap our discussion for today about the introduction of case reports. I hope you find this video helpful. If you like it, please subscribe to my channel and follow me on Instagram and Twitter. Thank you so much for watching, and see you in the next part about the discussion of case reports.